Have you ever stopped to think about the incredible journey sound takes from a whisper to a symphony before it even reaches your brain? It is an intricate and perfectly timed process that brings the world alive. But what happens when something unexpected interrupts that journey right at its very beginning? Conductive hearing loss directly affects sound by creating a barrier to its passage. This type of hearing loss interferes with the way sound waves travel through your outer ear and middle ear, making it difficult for sounds to efficiently reach your inner ear. As a result, sounds often seem significantly quieter, and sometimes even muffled or distorted, impacting your ability to hear clearly. The core mechanism behind conductive hearing loss lies in a problem with the mechanical transmission of sound. Normally, sound waves are collected by your outer ear and then travel down the ear canal to strike your eardrum, which is also known as the tympanic membrane. These vibrations are then passed on to three tiny bones in your middle ear: the malleus, the incus, and the stapes. Together, these are called the ossicles, and their job is to amplify the vibrations and deliver them to the cochlea, the snail-shaped organ in your inner ear. If there is an obstruction or an issue anywhere along this pathway in the outer or middle ear, the sound energy cannot effectively transfer. Common culprits include excessive earwax buildup that completely blocks the ear canal, fluid accumulation behind the eardrum often from an ear infection or allergies, a perforated or ruptured eardrum, or even problems with those small ossicle bones themselves, such as their disconnection or conditions like otosclerosis, which can cause them to harden and restrict movement. The crucial and often positive point here is that the inner ear, which is responsible for converting sound vibrations into electrical signals that the brain interprets, is typically functioning properly. The problem is generally with the delivery system, not the receiver. For someone experiencing conductive hearing loss, this means more than just turning up the volume. You might find yourself constantly asking people to repeat themselves, or you may need to increase the television or radio volume much louder than other people in the room. Conversations, especially in environments with background noise like restaurants or busy streets, can become particularly challenging. People often describe the sensation as if their ears are perpetually plugged, or that they are listening to the world through a thick wall. Everyday sounds that once brought joy, such as birds singing or the rustle of leaves, might become faint or disappear altogether. If you notice these signs, the best first step is to consult a hearing healthcare professional, such as an audiologist or an ear, nose, and throat doctor, also known as an ENT. This type of hearing loss offers a unique and often hopeful prognosis compared to sensorineural hearing loss, where the damage lies within the inner ear or the auditory nerve. Because conductive hearing loss frequently has a physical, identifiable cause in the outer or middle ear, the solutions can be quite direct and effective. These might range from simple procedures like professional earwax removal, to medication to clear up an infection, or even surgical interventions to repair a damaged eardrum or reconstruct those tiny ossicle bones. The potential for significant improvement, or even full restoration of hearing with proper treatment, is often quite high, offering a very positive outlook and a clear path toward better hearing. Understanding exactly how conductive hearing loss impacts the way you hear sound empowers you with crucial knowledge. It helps you recognize the symptoms, understand the underlying issues, and most importantly, seek appropriate and often very successful help. Knowing that the problem frequently stems from a treatable physical barrier in the ear's pathway can open doors to effective solutions, leading to clearer hearing, improved communication, and a significantly richer connection with the vibrant sounds of your world.